My name is Dr. Alejandro Ramirez. I'm an anesthesiologist here at St. Joseph Hospital. Have been for 20 years now. And I want to talk to you a little bit today about what we do as anesthesiologists here, kind of from your perspective. If you take a look at surgery and what we do, it involves a multitude of stressors. Stress preoperatively, you may be anxious, you may be in pain. Those stressors are what anesthesiologists are supposed to control, both preoperatively, intraoperatively, and postoperatively as well. The way we do it preoperatively is we come to the recognition that we are neighbors. We're neighbors taking care of neighbors. Most of us live in this immediate area or close by, and we really value our contribution to this hospital through our patients. And we are a group that actually looks to seek partners that will fulfill that mission that we have, which is to make everybody feel at ease, make your perioperative experience as enjoyable as possible, and make it as stress-free as possible. Once we evaluate you from a preoperative viewpoint, through your chart, lab work, etc., then we start asking you some questions. And those questions are designed to fill in any gaps that we might have regarding your other factors that may be important to you. Your need for pain relief after surgery, your emotional state, anything else that may lead to less than desirable outcomes in surgery, as I mentioned before, because stress can play a role in that. So we seek to understand that, where exactly you're at in the whole perioperative process as a patient, not as a number, not as a chart, but as a real patient, because we or our families have been patients at this hospital as well, and we value the care that this hospital gives us. So to that end, you'll have a preoperative evaluation by your anesthesiologist prior to surgery, in which we will have a complete review of your chart, and you will have the ability to then engage us in asking various questions. Now, those various questions will center on what type of anesthetic you should have, and that's always best done in consultation with your anesthesiologist, not in consultation with your surgeon, although we work with our surgeons collaboratively to educate them on what we feel would be the best anesthetics for different procedures. So the way we do that is you come in for surgery, and then we go over the different options that you have. Now, your options may even involve not having an anesthesiologist. You may have a procedure that just involves local anesthesia with your surgeon and monitoring by a nurse at the time of the procedure. Those are usually minor procedures, don't require an anesthesiologist. And then the anesthesiologist-involved procedures run a full gamut. They run anywhere from just plain sedation, where we would just monitor you and sedate you as needed to maintain your well-being and your comfort throughout the procedure, to general anesthetics where you're totally asleep for the procedure, to regional anesthetics and postoperative pain control. Now, the difference between generals and the regional anesthetics and their usefulness will depend on your procedure, your desires, and also the opinion of the anesthesiologist that you will be assigned to.